Today we'll talk about the breast reconstruction for the different diseases of the breast. Breast reconstruction after mastectomy is typically a stage taking place over months or years, and it can involve several procedures, including tissue expanders and making a mold, removal of tissue expander, insertion of implants, revision of reconstruction breast, and balancing procedure, nipple reconstruction, areolar tattooing. But everything is based on the previous surgery and healing. So post-mastectomy tissues, which procedures include a patient required, depends on extent of how much tissues remains after mastectomy. If there is sufficient tissue, immediate reconstruction may be performed by placing a permanent implant, or if additional tissue is needed, a tissue expander may be placed or a graft may be performed. Tissue expanders are additional tissue must be developed, and a tissue expander is placed in the chest wall and filled through a port at regular intervals to stretch out the skin. Some expanders are designed to be left, but most of them are removed and replaced with a permanent implant. Tissue grafts are used when more bulk is needed to reconstruct the breast mound. A TRAM flap transfers tissues from the lower abdominal wall, and it is based on the inferior and epigastric vessel. A latissimus dorsi flap tissue is taken from the back. Although transverse tissue alone may be sufficient, an implant can also be placed underneath. After the tissue expanders have been carefully expanded, it is removed and replaced by a permanent implant, typically during the same encounter. Implants are filled either with the saline or silicone, and many models are available to try and match the patient's natural contour. Because of the expander is a foreign body, it's normal for the capsule to be around it and in the breast, and adjustment to the capsule is often necessary to see the permanent implant properly. It is not uncommon for reconstructed breast to require surgical revision at some point, and this can be necessary because of contour deficits such as irregularity or deformity in the reconstructed tissue, inadequate projections, and asymmetry or disparity within the native tissue. Surgeons are usually adamant that these issues are in the nature of the breast reconstruction and do not represent the complication of the graft or implant. Unlike the contour deficit, asymmetry and capsular contracture is a complication of the implant. A thin capsule forms around all implants, and a contracture is when the capsule thickens abnormally to form a scar tissue around the implant and becoming hard and painful. And capsular contracture may require capsulotomy or capsulotomy of the reconstructed breast. A fat necrosis is a complication of the TRAM flap. Fat within the flap becomes ischemic due to inadequate blood flow, and it hardens and must usually be excised. Balancing procedure as an alternate to revising the reconstructed breast, or sometimes in addition to it, procedures are also performed for the native breast, and this include augmentation, reduction, mastopexy for a small, larger, or ptotic native breast for balance between the reconstructive breast. Nipple reconstruction is usually performed via the skin graft. Common techniques include the skate graft, top head graft, or star graft. The nipple reconstruction is usually delayed for several months after the breast mount reconstruction to allow the new breast time to settle. Areolar reconstruction can also be performed by grafting, or through tattooing is much more common. The point of reconstruction following mastectomy is obviously not to restore the function, but it does not need to be. And the point of breast reconstruction is to make the patient whole again. Thank you very much. Hope you have enjoyed the lecture. If you have any questions or queries, please let me know.